For investigation of spleen, the patient should lay on the right side, please. Это left side, а это right side. The right leg is straight. The left leg is bent in the joints. Here is a spleen. For our purpose, we assume that the length of spleen is on the 10th rib. What is the 10th rib?
Fourth rib. Floating.
So census is
Phoebe. What is the 10th rib? The last of false ribs. 12, chaff, and 11 are costa fluctuantes, and the 10th is the last of the false ribs. So you count, the last rib is the 12th, then the 11th rib, and here is the 10th rib. So you percuss along this line from anterior and from posterior axillary line to find the dull sound. This is the length of the spleen. From the middle of this, we draw a perpendicular line and make also, how to say, сходящийся, invert percussion. Okay. Can we measure the sizes now? Not? Why not? Border of lung? Or what? No point. Can't understand. Can measure?
Can.
Measure? No, we cannot measure. Why? Because percussion is not very precise, so we have to prove the percussion result by palpation. Same as liver. The 10th rib line is our third finger. This to compress from above. We place the right hand under the lower pole of the spleen. If it is lower than the costal arc, if not, by the costal arc, and then breathe in, skin fold towards the umbilical ring, breathe out, we penetrate, we try to meet the arms, breathe in, breathe out, and then breathe in deeply. Try to palpate. Of course, by this distances it cannot be palpable. So palpation does not contradict the percussion. You can let these borders and measure 7 by 5 centimeters. That's all. Actually, I will not ask you about palpation of spleen. So it is good that if you practice a bit, but I don't think you will need this in your practical life, because palpation of palpation of spleen is very uncommon situation. In absolutely most patients, spleen is not palpable. And in many hospitals in the world, also in Malaysia, I hope you have ultrasound devices and you can measure the size of spleen. Much more precise. For your general skills, this is good training, but for practical life, actually it's a bit obsolete. Okay, now the rest of the previous class, you had also to discuss 5 symptoms for liver and bile tract. Да? 5 symptoms. Пожалуйста, ложитесь на спину. На спину. Руки вниз. Oh, did we discuss ortho symptom? No? I knock against the costal arc. Is right more painful than less? No. Ortner symptom is negative. Didn't we discuss this? Yes. We discussed. Okay. That's good. Care, Lepene, Murphy and right Phrenicus symptom. Okay, this is good. This is good. Did we discuss how to find ascites? No. Did we discuss rebound symptom? Yes. Good. If you percuss abdomen, and you find in lateral spaces, lateral places, some dullness, you have to suspect the ascites. Or due to other reason, you suspect the ascites. So you have to check the ascites in the patient. There are many methods to diagnose ascites. You should know 3 of them. First is fluctuation method. You place 2 hands on the lateral sides of abdomen and you make such like pushes. If there is a fluid, a real amount of fluid, like 5 liters for example, the wave will go through the fluid from one side and you will feel this by your another hand. In some books you will read, if you feel the wave, you must make a barrier with a third hand on the anterior medial line, because sometimes this wave can be conducted by the anterior abdominal wall. This is correct, especially for 3-handed doctors. This is very good. So, yeah. I am 2-handed. That's my problem. So actually, if you feel the wave and you have experience, you can decide if this wave is conducted through the water, through the ascites fluid, or by the anterior abdominal wall. The feeling of these 2 variants of push are different. But if you end up as a patient to place the third hand here and do again, And if the wave disappeared, this was a wave conducted by abdominal wall. Is this clear? Okay. Fluctuation wave. To be positive, it needs a lot of fluid, at least 5 liters in this abdomen. Second, more precise method is lateral percussion. You percuss from umbilicus to the side, dull sound, and you ask the patient to turn on the opposite side, please. And you percuss once the same point. In here it was dull sound, and now it's tympanic sound. It means the fluid has gone. The fluid has gone, it is present, and it is free fluid. Free fluid in abdomen means ascites. It's more precise method. And a bit more precise method is when you ask the patient to stand up and you percuss from umbilicus to the pubic bone to find the dull sound. Dull sound. And then you fix this position and ask the patient to lay down and percuss once again here. And if sound changes from dull to tympanic, means the fluid has gone, fluid is there, a free fluid ascites. Okay. Now, please practice this ascites methods. Maybe not the last one, because it will take too long, too much time. Stand up, stand up. But the first two methods, and if somebody needs palpation, percussion of liver from previous class, maybe somebody did not finish this. And after this, we'll come to the kidney.
Okay.